Welcome to Franklin County Home Health Agency's Where the Heart Is. I'm Jennifer Martin, your host for today's show. Franklin County Home Health Agency is a nonprofit organization. We have been providing high-quality home health care and hospice services to people in need throughout Franklin County for 40 years. We are proud to be our community's trusted experts in home health care, and we're happy to bring you these shows dedicated to providing information about our agency's programs and services, as well as offering helpful wellness tips to help you stay safe and healthy at home. And it is February now, so it is Heart Health Month, and I've invited two guests to talk with me today about this important topic. So with me are Michel Consejo, State Representative and a former board member with Franklin County Home Health Agency, and Kate Kasowitz, a current registered nurse at Franklin County Home Health. So thank you, Michel and Kate, for being here today.
Thank you
for braving the snowy roads and talking about our hearts. So Kate, if you could start us off by giving some information about what we're talking about when you hear heart disease or heart conditions. What are some of the specific things we're talking about?
So Jennifer, most heart disease is caused by some kind of damage being done to the coronary arteries, which is just a fancy way of the tubes that bring the blood, which bring the nutrients and the oxygen to our heart. So most of the diseases these days are caused by either hardening or clogging of those arteries. Once the heart can't get the blood that it needs, it tends to be damaged and things tend to not work quite as right.
Thank you for explaining it that way. I think sometimes we just think, okay, heart attacks, heart disease, but taking a good look at how the system works together and keeping that system working well.
Absolutely.
So can you name some of the other conditions relative to heart disease?
Sure. So when you do have a clogged artery, you can have something called a heart attack, which means the blood supply is cut off to the heart, thereby damaging the muscle of the heart, and the heart then can't pump blood to the rest of the body. That heart muscle can be irreversibly damaged sometimes. So the heart can't repair itself, and so you then have heart damage for the rest of your life.
Okay, so a long-term condition following a heart attack.
Yes.
Okay. When I hear the word congestive heart failure, a lot of times that's the same kind of condition that leads to a heart attack. Is that the term?
Congestive heart failure is predominantly caused by damage to the heart that's been done, and the heart can't pump as effectively, so the blood pools in the heart, thereby congesting the heart. So after a heart attack, there can be damage to the heart, which then doesn't allow the heart to pump effectively, and thereby not allowing the heart to pump the blood, and it thereby sits in the heart, and we can't move the blood around, which thereby doesn't allow the rest of our body to get the oxygen that it needs.
Okay, thanks for the explanation. So let's get into risk factors for heart disease.
So one of the risk factors that doctors and nurses like to talk about is blood pressure. So these coronary arteries, or the hoses that bring blood to us, bring blood to our heart, can be affected by blood pressure. So if you think of a garden hose that you leave in the sun, and all of a sudden you get this big bleb, well, that's the pressure. And you can think of high blood pressure can cause these very, very delicate vessels to bubble or burst, or they're very susceptible to any kind of damage being done by extra pressure. Now, if you're overweight, sometimes weight can also be a risk factor because you don't exercise quite as regularly, or your heart has to pump blood to a larger area when you're overweight. So both of those things can cause the heart to either not work as effectively if you're not exercising, or have to work harder because it's got to pump the blood to a larger area.
Okay, so blood pressure, your weight, what other risk factors might?
Well, smoking is also a known risk factor because smoking also affects the blood vessels that are throughout your body, so including the coronary arteries. So the nicotine that you get from smoking causes the blood vessels to react in certain ways, and after time after time, being exposed to that chemical can cause those blood vessels to be damaged.
Okay, and you mentioned when you're talking about weight, exercising, but even if you're in normal weight, how does exercise contribute?
So exercise, when you do a cardiac exercise or aerobic exercise, you're exercising the muscle of your heart and thereby making it more efficient. So we all know that the more times that we do a bicep curl, or our biceps get stronger and we can do it easier. So what we want to do is strengthen the muscle of our heart. So every pump, it's much more efficient. The less pumps it needs to use, the more efficient it is, and that's a healthier heart.
Okay, good. Well, wonderful overview to get us started. Why don't we jump into a personal story, Michel? You came to share with us something that happened to you within the past year, and if you could talk, bring us back to what happened to you and your experience.
Well, it's very simple. I'm a 60-year-old man. Never really had any symptoms about heart attack, heart problems. I'm a legislator and I live on a hill when I'm in Montpellier. And last March, or April maybe, excuse me, when I was going back from Montpellier walking to my apartment, I had to stop in the middle of the hill. Which, I said, well, I really need to cut down on smoking. But at that time, I was not smoking a lot. I was already on the way. I had decided I was going to smoke less, and I was on Chantix, which worked out for me. So I was really not, but I was noticing really different symptoms. It was really, I had to stop. I had to stop in the middle of the hill, catch my breath, and start again. So I decided that when the session was done, I was going to see my doctor, which I did. My first inclination was to think that I had something maybe in my lungs. We go to the State House, a lot of people, we shake a lot of hands, we see a lot of people, we always catch something. So we did, and my lungs were fine. So my doctor suggested, why don't we have a stress test? He actually suggested it right away. I went to the stress test, and I was not very long on that stress machine, which is basically a regular treadmill.
Okay, yep. They want to see what your ability is there.
They hook you on to monitors, put you on the treadmill, and very easy incline. I didn't even get to the first incline, and I was stopped. I could see, as I was walking, I could see the nurse looking at the screen and shaking her head. And I could see my doctor just moving around, going to look at the screen, and he didn't take a minute and a half, and he said, we got to stop. And I said, why are we stopping? He said, because you have a problem that we cannot fix here. You need to go and see a cardiologist. So he referred me to a cardiologist in 2 days, which is very rare. So usually those people you don't get to see right away.
Sure.
So it's not a good news.
No.
I was in the hospital for a more invasive procedure, which is they insert something in your groin, and they actually go into your heart to see inject a dye, which is very interesting because you can see the whole thing. You are under, you don't feel it, but you have those screen and you can see all the little vessel. It looks like a spider web.
Wow.
And then they inject the liquid, and you can see a puff of things. And I could see that my puff was not going in the right direction.
Right.
It was not a regular puff. It was really a, so I'm saying, okay, I got something going on here. And again, you start looking around you, and you see the people whispering, looking at each other. And they stopped after half an hour. And they said, we cannot put stents, we need to talk to your wife. So they brought in my wife, and once my wife was there, he basically told me, Michel, we could put 15 stents, which is not done because that's way too many. But we could put 15 of them, and you still will have a problem. You need to have open heart surgery, which came as a real shock. I was not prepared for that. He said, you have at least 3 arteries that are blocked. One, we know for sure is blocked 100%, nothing is going through. 2 is 90%. And you may have more that we cannot see. He scheduled me to see a surgeon. The surgeon said, yes, we're going to operate first thing in the morning, on Monday morning. This is Friday night. On Monday morning, I was operated on, and I asked, of course, if I was going to go home in the weekend, and they said, no, no, you're not going home, you're staying right here, just in case something happens. All that in the space of a week.
It happened so fast, came upon you that fast, and then all that.
In the space of a week, I went from thinking I was in good shape to having a quadruple bypass. As it turned out, when they did open me up, they found out there was another artery in the back of my heart that was only functioning at 50%. So we have what, 5 arteries that are hydrating our. So we were talking a little bit before the show about I don't think I'm overweight. I may be a little heavier than I should be. I think I'm in fairly decent shape for somebody my age. And yet, I was facing an instant death because apparently people like me have only one heart attack.
Yeah. Amazing.
And usually don't survive it.
So you're, like you were saying earlier, we were talking that would be, if you hadn't caught that when you did, or your doctors hadn't, that would have been the big
That's
type
right.
of heart attack.
That's
so
right.
you really had a close
And that's
call.
what I'm here for today. Is to, I think we all have in our head a certain picture of what a heart attack and somebody that's going to have a heart attack should look like, or feel like, or be like. And the reality of things is that it's not real. Yes, those people may have, if you're obviously obese, or they may have more tendency and more at risk. But the guys that is not obese and the guys that exercise, the person that is in somewhat decent shape, is usually the ones that don't survive.
Like you're saying too, is we all need to take it seriously. We will talk about the symptoms that we should be looking for that may arise, but your story is to say that sometimes those don't come in order, and you have to pay attention to your body and ask.
If there is one thing that, and I'm going to look at the camera because I want the people to, if there is one thing that I found out is that don't be your own doctor. Be the person that diagnoses yourself. You know better than anybody else what's going on with you. And if there is a change that feels or seems like needs to be investigated, don't hesitate. Don't make your own diagnosis. That could be the difference between me sitting at that table today talking with those two wonderful ladies or being in a cemetery somewhere where people can come and visit me. So I know it's a bit hard to say that, but it is the reality, folks. Don't take this very seriously. You have people that are willing to help you before, during, and after, and take advantage of that.
Definitely. Thank you, Michel. It's a powerful story and a powerful message to share with folks. I'm glad that you're here with us, sitting with us today, too. And in recovery and doing well. It's a very important message. And Kate, can you talk a little bit about what you heard about his story and as it relates to the medical field that you...
So absolutely. So you had open heart surgery, which they make a large incision across the sternum, and they actually go in and replace the arteries that are clogged, which is a significant surgery and actually has quite a long recovery time. We have a wonderful medical community here that does it often, and what we like to tell people is that the recovery in the beginning is difficult, but people do feel an incredibly amount better at the end. Once they have new, not clogged arteries feeding their heart with good, healthy blood, they can recover and go through what we call cardiac rehabilitation, where you start an exercise program and gradually build up to, a lot of people gradually build up to fitness levels that they were never at before, because they now have this newfound ability. And so it feels wonderful. Some of the risks that we see afterwards are obviously things having to do with an incision or an infection, and those are things you want to pay attention to. But we have some very capable doctors in this community that do a wonderful job.
Yeah, good. Thank you for sharing. What kind of exercise program do they put you on right off, or what kind of recovery?
Most of my real difficult time was not so much with my cardiac operation, which went real well. Incidentally, when you go through something like that, to think that somebody has actually held your heart in their hand and took a piece of your vein from your groin and actually put it back, it's an amazing thing. It creates a bond between your doctor and your patient. Another thing that I may want to mention, the doctor told me that, he said, Michel, when I got to your heart, when I had it in my hand, I could see that the bottom part of your heart was damaged, was not alive, was not beating. And he said, by the time I was done, I could see some little flickering of life coming back.
That's amazing.
So, there is hope.
Yeah, right.
There is hope. Do it before this happened. But so after my initial recovery time at home, where basically I couldn't do nothing but laying down, I decided to join cardiac rehab, and I did. And like you were saying, at first it seemed just moving just walking on a treadmill seems like something incredibly difficult, and it is. But I remember as I was progressing, constantly waiting for that time where I will get short of breath, where I will stop like I was doing before, and he never came.
There you go.
He never came. All what he did is I was breathing heavier and deeper, my heartbeat was getting faster, but the shortness of breath never comes.
Good.
Even when I exercise now, and I was kind of concerned going to Montpellier for 4 months because I'm thinking, okay, I cannot exercise down there. I'm actually gone through the whole 3 stages of cardiac rehab. I'm in the 4th stage, which allows you to go 2 times a week. I joined a gym in Montpellier, and I go into the gym 2 or 3. Yeah.
Good.
Because you feel good about it.
Yeah.
You already do.
Yeah. Oh, good to hear. Awesome. Now, Kate, let's talk about home health now. And when somebody comes straight from the hospital after this kind of operation or condition, you mentioned incisions and stuff. Talk about what the care looks like.
So the intention of home health is obviously to transition someone from a hospital environment where they have 24-hour nursing care and doctors all around to their home where they have none. So the intention is to support them at home, offer them nursing care in their home, and to teach them, educate them how to be independent with their own care. The initial stages of home health care, and research has shown that the first couple of days can be very important. Taking your medications appropriately, along the right schedule, being monitored appropriately for symptoms of infection or symptoms of some complication to the surgery. The first few days home from the hospital can be hugely important in keeping you home from the hospital. We want to make sure that you're not retaining fluid, that your heart is functioning appropriately, and that is not allowing you to retain fluid. Because if your heart is not functioning appropriately, therein lies the congestive heart failure. So we can all monitor that at home with appropriate nursing care and interventions.
Perfect. So every case is different, but about how long does somebody receive home health care after this kind of operation?
Oh my gosh, so it's terribly individualistic. So there's, it depends on what the word is, comorbidities, or what else you have sickness going on. So someone who is otherwise healthy, who is a non-smoker, it can be 1 to 2 weeks while their incision heals and they're on the road to seeing their doctor. Someone with, say, diabetes or who continues to smoke, they might have a much longer recovery period and might require skilled assessment and or education even longer.
Sure. Okay. What about some technology that helps you keep people at home?
So we currently run a program called Home Med, which is a monitoring program which offers vital signs that get transmitted through the phone line from the patient's house directly to our office and are then reviewed by a nurse. The program also allows for there to be a various number of questions that can be asked of the patient. Are you more short of breath today? Have you gained any weight today? And the patient can answer yes or no. And one of the questions can also be, do you need to speak with a nurse today?
Yeah.
And so it just prompts the patient, and it gives them that opening to call a nurse and speak with someone about what's going on.
Yep. Like Michelle was saying, you reach out when you feel something's off.
Yeah.
And some people aren't quite as good at reaching out, so it gives them the opening. If they hit yes, and then a nurse will call them. So it's much easier, and we can actually help them and teach them to monitor their own blood pressure in their own weight, because they get used to it. They like to be able to keep track of what's going on, and it's helpful for us to see how they're tracking every day.
And that's building habits in their life to, once they're off that service, to continue that kind of tracking.
Absolutely.
Or
and it can be very clear to some patients when they eat Burger King for dinner, and then the next morning they're 3 pounds heavier.
So now they're seeing what makes that impact on their health.
They can see almost an immediate impact on their health.
It's amazing. Can you talk about the teamwork involved? Who else can help somebody with heart disease from the home health aspect?
So we have nurses, we have licensed nursing assistants who help people with personal care if they don't have loved ones to help them with that. We also have physical therapists. So if you were in need of physical therapy, we have occupational therapists as well. We also have nutritionists, a dietitian, a registered dietitian, who can also help people learn about better nutritional habits to prevent heart attacks. So we have a whole gamut of professionals in the agency.
Good. Now, you were mentioning the keeping people out of the hospital, so this has a huge impact on the whole healthcare system.
Absolutely. So keeping people from rehospitalization is a huge initiative going on in the healthcare community. So if we can transition people home well, and we can assess them appropriately and care coordinate within their doctors, make sure they have their doctor's appointments, their follow-up appointments. That's another huge aspect of keeping people healthy and well monitored. So we can obviously keep them from rehospitalization. We can make a huge impact on the healthcare.
Awesome. And from rehospitalization or using the emergency room when they could have avoided that by going to regular doctor
We don't
visits.
want to wait for it to get that acute. If we can, if a skilled assessment can come in and say, oops, you know, you're not looking so good, let me take a peek, and then all of a sudden we come up with, oh, they've gained 3 pounds. Well, maybe we can care coordinate with their doctor in order to maybe adjust their medication or talk to them about diet before they gain 5 pounds, and now they're in the emergency room.
Dangerous place.
Short of breath, and so we try and prevent that.
Okay, good. Talk about the symptoms. You're mentioning some of the things here, and like Michel said, it is important to recognize that this can come upon you just like that, or that symptoms may have been so gradual over time that you were shoving them off as something else.
That's right.
But talk about some of the symptoms people really should be aware if it's happening to them that should raise red flags.
So classic red flag symptoms of a heart attack are, you know, chest pain, shortness of breath. You know, it's described as an elephant sitting on my chest. It's described as arm pain that radiates. Sometimes it's back pain. But the predominant classic symptoms are the shortness of breath and the chest pain.
So what you're mentioning is the symptoms that are going to happen if an attack is imminent. So that's like an attack's going to happen, you might feel these. And the other symptoms may be, as Michel, he didn't get the attack, but he was, they're not very obvious symptoms because it came upon you.
If I may, one of the things that also I noticed during that 4 months, 5 months before this happened, is I was getting tired.
Very tired.
I was getting tired too easily, to the point that sometimes when I was driving, my eyes were, I had to stop on the side of the road and stop. So, you know, again, I put it, you always find good reason why you do what you do. So in my case, it was, well, you know, it's a session, it's a stressful session, so, but I was feeling that symptom of tiredness, no matter, and it was not about sleeping. It was just, I was feeling really dragging.
And that's from that lack of getting the blood where you need.
Lack of appetite, things like that, things that you're just drained. I mean, that would be an indication. You know, your loved ones will say, your loved ones will probably pick up on it before you will. And so that's also those are the creepy crawly symptoms, the ones that kind of sneak in underneath the carpet. And so those are definitely, if you're getting more fatigued or if you're, you know, just not feeling up to par, you're not hungry. Those are all, you know, all symptoms of lots of things that should be assessed by your primary care provider.
So reach out. Now, what about women? It is the #1 killer of women in America. It's the #1 killer of men and women, but predominantly for women. Do the symptoms come differently for women, or can they?
So again, the classic symptoms, yes, women can present with nausea and vomiting, predominantly chest pain, shortness of breath. Women have a tendency to be a little bit more of the caretaker role, so they don't reach out to get the emergency care. They always need to, you know, make sure Susie's gotten off the bus before they call the ambulance. So I think that women also have a tendency to kind of let it go a little bit longer, but predominantly it's the chest pain and the shortness of breath. Nausea and vomiting are one of the things that we do see a lot in women.
A little bit different in women, okay. Let's talk about what you can do to prevent. We have touched on it a little bit, but talk a little bit more about prevention and its role.
So exercise is keeps the heart efficient and healthy. It's, you know, it's just like getting an oil change to your car. You just want to keep it running efficiently. Good, healthy eating. A lot of the clogging and hardening of the coronary arteries or the hoses that feed our heart are caused by cholesterol and bad hydrogenated fats. So good, healthy eating, high fiber diet brings down cholesterol. Those are all, you know, great ways to. Those are really really the best ways to prevent any heart disease.
Okay, good. So we are lucky in our community to have a lot of resources. As we've mentioned, our healthcare system is fantastic if you have experienced this trouble, or even in prevention, because our agency is a member of the Center for Health and Wellness, and that's their motto: move more, so exercise, eat well, and don't smoke, or smoke less and try to quit smoking. So the Center for Health and Wellness is, like I said, a Northwestern Counseling and Support Services, Northwestern Medical Center, and Franklin County Home Health. So individuals in our community can look up free and low-cost programs to help them stay well from a lot of conditions, but particularly with Move More, Eat Well, and Don't Smoke helps to prevent heart disease. So thank you guys for coming here and talking about this important topic with me today. And Michelle, best to you on your continued recovery. And Kate, thank you for all that you do at Home Health, you and your team, keeping everybody safe and healthy at home. Is there anything before we close that you want to add that we maybe didn't touch on?
One thing I want to mention about what happened after, I was on a medication called Coumadin, and Coumadin is a blood thinner, and it requires going to your doctor fairly frequently, apparently, to monitor the level of how thin your blood becomes. This is something that I suppose home health can help people, making sure that you go to those appointments. This is very important. It's not something you can decide, oh, my Coumadin level or the thickness of my blood is just right. This is something that is scientific and cannot be winged.
Yes,
so
the help is there. So
yeah, for sure, especially at the first moments after the operation. This is really important to do.
Thank you for sharing that. Yeah, medication and taking it properly is a huge role in our health.
Absolutely. So with the big factors in not getting rehospitalized that we see is, medication, taking your medication appropriately, taking it according to the directions, making sure everyone's reading it, reading the labels, making sure you're all taking it appropriately, and keeping those follow-up appointments.
Yeah, and I can tell you one thing is that the list of medication is a mile long. It's not something you can just
so you can't take it
pull out of thin air. It's a mile long.
Sure. Yep.
Well, thank you very much, I hope that people will take advantage of Franklin County Home Health. It's a wonderful agency, and I hope that you will take care of it and help.
Thank you. Well said. So if you or your loved one suffers from heart disease and wants more information, please call our agency or speak to your doctor and call our agency at 527-7531 to see how we may help you or loved one at home. You can also check us out online at www.fchha.org. We thank you for watching today, and be well.